Afternoon. Today I will talk about all the exams I pass for prepared myself go to chemotherapy, and I know if I have another cancer for my body or no, and all these exams is important, and the doctor write for me all these exams, and I starting go to make these exams. The first machine I sit under this machine, sooner this one.
Obtained, or they may ask you to have an ultrasound. An ultrasound is a painless way of looking at usually masses in the breast to see whether or not they're cysts. Cysts are merely sacs of fluid, and they're not cancerous or precancerous. So ultrasound is very helpful because some lumps can just simply be a cyst. However, some lumps aren't, and some mammographic findings may not clear up with the additional mammographic images. So then what do? In the old days, you used to go for surgery, and now, in fact, we don't recommend surgery unless we're treating breast cancer. Breast cancer can be diagnosed effectively, efficiently, with minimal scarring, and accurately with a technique called core biopsy. The object of core biopsy is to sample a lesion. If it's benign, it averts an unnecessary surgery. If it's malignant, it helps the surgeon decide what kind of surgery they need to do.
After sooner, and I show for other video, the first video, room for mammography. Make a mammography, go inside, make a sooner again, because it's sooner important also for the doctor, and I show you why it's important. Because make an operation, not small operation by needles, and you will see. But you have heart, huh? If you have heart, you can look for the
biopsy site. To avoid unnecessary trauma to the skin, a small skin incision is made with a scalpel blade prior to the biopsy. The biopsy needle is inserted into the lesion using ultrasound guidance. Here you can see the lesion, and this is the biopsy needle. When the biopsy gun is fired, the interior shaft of the needle is fired first, immediately followed by the exterior sleeve, 22 millimeters into the tissue. The biopsy material is placed in an indentation in the interior shaft. The material is placed in formalin for pathological analysis.
So, mammography is important also, but this machine is press my chest, my breast too much, and I feel pain really big. For the side I have a tumor, I feel too much pain, but I can go ahead. Only few seconds here, leave me 5 minutes, 7 minutes, and make this told me will the machine move alone, and when catch it, start step by step, push. After here come again, and let me take other side. You will see for a video, and make picture, and here stay for other room. Every time stay for other room. Protect themselves, sure, and I stay alone for this time, and all time I stay alone for one room, and then stay for other side for other room, and they show have one glasses between me and them, and have microphone told me go ahead, move around like that, no, and finish for 10 minutes, 12 minutes for this machine, and you'll see this machine.
In mammographic positioning and techniques,
The test will be performed using a special X-ray machine that delivers low-dose X-rays to the breast and has special platforms or paddles used to compress the breast. Some women worry that a mammogram will be painful. Compression of the breast is sometimes uncomfortable. However, it's very important as it allows the breast tissue to spread and flatten. This ensures a clear view of the breast tissue and reduces the amount of radiation needed to make an image. Your breast will be compressed for only 20 to 30 seconds. The entire mammogram procedure takes about 30 minutes. A radiologist will review your X-rays and send your referring healthcare provider a report of the findings. It is not uncommon for an initial mammogram to have suspicious findings since there are no previous mammograms that can be used for comparison. Most suspicious findings are benign and may be nothing more than cysts or spots of dense tissue. Occasionally, suspicious findings are the result of an unclear image. An additional mammogram to further evaluate a trouble spot is called a diagnostic mammogram and will focus on the problem area. In some cases, a breast ultrasound may also be recommended. You may want to schedule your mammogram